this video, I will talk about what type of valve is appropriate for young and what type of valve is appropriate for older or pregnancy. So whenever a patient has serious valvular heart disease such as severe mitral stenosis with mitral regurgitation, aortic stenosis, aortic regurgitation, or other valvular disease that requires surgery, we need to replace the valve and place a different valve. So the new valve that we place after surgery can be a mechanical valve or it can be a bioprosthetic valve. So what valve should we choose for each type of patient? So whenever you have a young patient, especially a young male, then the mechanical valve is more suitable because the mechanical valve has long durability and the cost is cheaper than the biologic valve. But the only issue with the mechanical valve is anticoagulation. You have to have anticoagulant, which is warfarin. You have to take it regularly and keep the INR at the desired level. For example, for mitral valve, like around 3, for the aortic valve, around 2. You have to keep that INR level to prevent the valve thrombosis. So that is the only or main issue with the mechanical valves. But if a patient is older, for example, like a very old patient who will not survive longer than 15 years, then a bioprosthetic valve is a good option. Also, if the patient is pregnant or in a reproductive age woman, then a bioprosthetic valve is more desirable. Why? Because it does not need long-term anticoagulation, which is hazardous in case of pregnancy. So women in reproductive age should have a biologic valve. And also an older man who does not have a long life expectancy, older man or maybe women does not have long life expectancy, should have a biologic valve. But in any case, we have to consult with the patient and tell them the upsides and downsides of each of the types of valve, and we should have a discussion with the patient and ask for the preferences that the patient has. And ultimately, the patient decides what type of valve he or she would like to take. But we have to give the options, and the patient should be well informed about the benefits and the disadvantages of each of the types of valves. That's all. Thank you.